Well, welcome everyone to our first Community of Practice session for 2022. Do feel free to introduce yourself and what area of work you work in the chat if you want to do that. Plus, if you are new to citizen science or if you're working on a citizen science project at the moment, we'd love to hear about it in the chat. I think we'll just get started, and some other people might be kind of arriving. But today we're joined by Dr. Kim Jose and Kate Garvey, who will be speaking about their experiences of piloting a citizen science approach to audit rural walkability in Tasmania. But before we begin, I would like to acknowledge the traditional owners of the lands in which I'm joining this session from today, the Gadigal people of the Eora Nation. And I would also like to acknowledge the traditional owners of the lands from which others are joining this session from as well. We pay our respects to elders past and present and extend that respect to any Aboriginal or Torres Strait Islander people who are here with us today. And do feel welcome to share the lands that you're joining from in the chat if you'd like to do so. So my name is Yvonne Laird. I'm based in the Prevention Research Collaboration here at the University of Sydney, and I'm co-leading a programme of work on citizen science and prevention, which is funded by the Australian Prevention Partnership Centre. And the programme of work aims to embed citizen science approaches and policy and practice settings across Australia. And as part of this work, we host this citizen science community of practice, which brings together people from research, policy, practice and community settings who are interested in using or learning more about using a citizen science approach in chronic disease prevention. So it's great to welcome you to this first seminar of 2022. And these seminars are really an opportunity to learn from others about how they've applied citizen science approaches in their work to address key prevention challenges. And they're really meant to be a kind of window into the experiences of our speakers and how they've experienced applying citizen science approaches, which might not often be seen in a scientific paper. So we're really looking forward to the session today. If you are interested in finding out a bit more about the community of practice or joining, then we'll share details on how you can do that at the end of the session. Before we start, I would like to acknowledge the Australian Prevention Partnership Centre who are funding this work that we're doing in the citizen science space, and particularly the Prevention Centre's funding partners who make this possible. Okay, so Dr. Kim Jose is a Senior Research Fellow in the Menzies Institute for Medical Research, University of Tasmania, and Kate Garvey is a leader and a manager within the Tasmanian Department of Health and has worked in the public health sector for over 20 years in a variety of leadership and public and policy roles. And between them, the speakers bring extensive expertise in research and policy in relation to supporting physical activity and walkability. And in this session, they will be discussing their experiences of using a citizen science approach to audit rural walkability in Tasmania. So we're really excited to have you both here today and sharing your experiences. So thank you for joining us. Before I hand over to Kim and Kate, I just wanted to let you know that the session is being recorded. And we also have Kylie Dunn here with us today, who's doing a graphic recording of the session. So if you want to follow along with Kylie's illustration, you can pin her in the Zoom to have a closer look at the illustration as we move through the session. And we hopefully will have some time towards the end of the session for some discussion and questions. So if you have any questions for the speakers as we move through, then please do feel free to add these into the chat. So I'll stop sharing my slides and hand over to you, Kim and Kate. Thank you.
Great, thanks, Yvonne. I'll just see if I can now start sharing my slides. Bring up. Is that looking all right?
Yeah, that was good.
Great. All right. Well, thank you on behalf of Kate and myself for inviting us along to speak today. We're really happy to share this work. We've spoken about in different places and different times, so it's great to do that this morning and this afternoon, I guess now, and we've certainly allowed plenty of time for questions. So just really briefly touching on our interest in physical activity in rural communities. I'm sure most of you are aware of the many health benefits associated with being physically active. And there are also other social, environmental and economic benefits from being physically active on a regular basis and active living. But what we do know is that rural and regional adults are less active than urban adults, and they also have higher rates of chronic disease. So this was a really important issue from both a research and a policy perspective, and that's really what's brought us together to work on this together. So we were interested in understanding more about physical activity, active living in rural towns and communities, and felt that the citizen science approach would allow us to investigate this in a way that perhaps us as researchers and policymakers would not otherwise be able to do. So just so that we're all on the same page about what we mean when we're talking about walkability, essentially we're talking about how well an area supports walking. And most of the audit tools or ways in which we measure walkability have been developed for use in urban settings. But obviously there's very important differences between urban and rural settings, and our study was trying to understand that a little bit more through using a number of different tools and citizen science to collect the data. So we've piloted this approach in 3 towns in Tasmania in 2020, so a couple of years ago now. We identified 3 rural towns in different parts of the state. So the towns were selected partly on the advice of partners about which towns might be more or less interested. We also wanted a geographic spread and also just some differences around sort of some of those characteristics. So town 1 is in the south of the state, has a population of just under 900 people, is on the coast, and the main industries in that area were salmon farming and timber production. Town 2 is up in the far northwest and was the largest town, almost 3,000 people, and that was more on a river estuary, and they had crops and dairy farming as their main products. And town 3 was our smallest town with only about 300 people and was more of a sheep farming area. So quite diverse when it comes to that sense of what was going on in these towns. And we're also guided by their interest in sort of investigating active living in these towns. So when it comes to the citizen science involvement, we sort of almost have 2 groups of people. In each of our towns, we identified a local community champion who really became our key contact and a key person in that town that we linked with. The community champions played a really important role in many parts of our project. So they helped recruit other community members or citizen scientists. And then they supported them while they were doing their active living audits, and they sort of helped with troubleshooting. They also helped identify which parts of the towns, because in the larger towns we couldn't capture the whole town when we did these audits. So the community champion played a really key role. And then the other community members were more involved in the actual data collection. Following the audits of the towns, which involved a checklist type approach, but also photos and images of the town, we conducted workshops in these different areas, and that was going back, taking some of the collated data and asking our community members to help us with making sense of the data that we'd collected and to identify priority areas. And then we did some more analysis and developed some reports. So when it came to the audits, these involved 3 different components. So there was a town-wide assessment tool which looked at sort of facilities, parks, playgrounds, schools, those sorts of things, their condition and accessibility. Then there was a policy and program tool, which was more looking at things to do with perhaps the council or policy areas around maintaining walkways or trails and those sorts of things. And then there was the more focused audit, which was the street segments. And this was this audit tool that most of the citizen scientists completed. And that was where you got down to the nitty-gritty of things like the condition of footpaths, traffic crossings and those sorts of things. And we were able to score these tools, or the town-wide assessment tool, and the policy and program tool had been set up in such a way that we were able to develop a score from those. And these tools had been developed in the United States for use in rural areas, and we modified them for Australian conditions and language. This is just an example of the types of photos that we received from our citizen scientists when it came to images that they felt represented some of the challenges for them around active living. So as you can imagine, we did get a lot of photos about footpaths and the conditions of those, but we also got photos of main roads or highways and intersections and other things. And these images were a really crucial additional part to our data collection alongside the actual audits themselves. Then, as I said, we did conduct workshops. Now in Tasmania in 2020, we didn't really have COVID as such within our state at that time, but we were still experiencing a lot of restrictions about what we could actually do when it came to research. Thankfully, at the time that we were conducting these workshops, we were actually allowed to go out into the community and conduct these face-to-face. And that really made a big difference, I think, when it came to some of that additional sense-making activity in these rural communities. We were prepared to do it online if we needed to, but yeah, the face-to-face was great. So in terms of the actual sort of citizen science approach, we found the two larger towns in our study. I might just ask someone, I'm getting some noise from someone who online, if they could mute themselves. Thanks. So yeah, so back to our findings. So we've got two towns, the larger towns, we had strong engagement from citizen scientists, but in our smaller town, it was really only the community champion who was able to engage with the project despite multiple attempts and support from the project team to see if they could recruit other community members. And it wasn't a huge study, and obviously we don't have huge towns. So, we had 10 citizen scientists who completed audits and then 11 who attended the workshops. And it was possible to do the audits and not attend the workshops, or not do the audits but be involved in the workshops. So we were fairly flexible around that level of involvement. So what did we find? We found that the town-wide assessment scores, the two larger towns actually had really fairly similar scores. So despite the town of 900 people perhaps not having quite the extensive range of amenities, they still scored pretty highly on that. It was our smaller town that had the lower score. But the program and policy scores were consistently low across all our towns. And we are aware that this might have been a challenge for our citizen scientists to actually know exactly what policies were existed in their town around some of these things. So that's one of the challenges when it comes to using citizen science, that they may not be aware of all the things that you're wanting them to collect data on. But what we found was the impact in the two smaller towns were significantly impacted by the presence of highways that bisected or ran through the middle of their towns. There were barriers to walkability, which were represented in some of those photos around the conditions of footpaths. A lack of road shoulders was a real issue, again, with those main roads that really had an impact. Traffic speed and the type of traffic. So obviously in our rural towns, we didn't have the same density of traffic that you'd have in a place like Melbourne or Sydney. But all of these had industry associated with them. So in the salmon farm, there are actually large salmon trucks that pass through the town. And obviously with the logging and timber industry, we get log trucks passing through some of those towns, or you get large agricultural sort of harvesting type equipment as well. So while the density might be less, but the type of traffic can really have an impact. Then there were other issues around lack of signage, lack of dog poo bags for those who like walking dogs, and seating. Many of our community members were aware that access, was limited for people with mobility challenges. and a recognition that in rural areas that there's a culture around prioritising car use. Now, I'm just sharing this slide to highlight the importance of taking our data back to the community and getting them to help us with some additional sense-making activities. So if you look at this screen, one of our citizen scientists went to a lot of effort to illustrate all the challenges around this particular intersection in their town, and how it was poorly signposted. This is actually the main highway where some of that heavy industrial trucks pass through and go around this bend to continue north and south. And looking at these images and some of the audits, we probably might have identified this as a main priority for that town, but it was actually the other photo of the highway that became really apparent during our discussions, that this illustrated a real issue in this town. So while it was a small-ish town, there had been some developments in the town sort of to the south of the town centre. And while a lot of the town centre had really great trails and tracks and was very well connected, this part of the town to the south was not connected. And this is the sort of highway that people had to negotiate if they were going to walk or cycle to get into the shops or the school or other facilities. And interestingly, to the south of the town, that was also where the oval was, the main oval. So during our discussions, it became really apparent that this created a real barrier in this particular town. And it was this that was identified as their priority ahead of the intersection, even though that was obviously also an issue. And this idea about better connections between parts of towns, rather than perhaps you might have anticipated beforehand that people might have wanted more facilities and more amenities in those towns, became clear that actually many of in the two larger towns at least, that they just wanted better connections and linking between the facilities that already existed rather than new things. So after we'd done that, we did ask at those workshops how our community members would like us to share the information back with them. And they were all very keen to have reports, because many of them thought they'd be taking this information to their local councils, and that a report would be of great assistance to them when it came to doing some advocacy for change around those priorities. So we developed reports for each individual town. We then had a summary report and then this infographic, which summarises some of our findings across those three towns. Since that time, we've had some additional feedback from one of our towns where quite a lot of advocacy has been going on as a result of the report that we provided them. So the report was tabled at their local council meeting and has been discussed at some of the subcommittees around health and wellbeing and aged care, I think were two of those factors. Last year, there was also a community consultation process around the highway that went through their town, and they were able to draw on the results from our report to provide some feedback around that. And then it's also helped inform, on the right there is an e-petition that was lodged in the Legislative Council, which had about 250 signatures, which might not sound like a lot, but that's a quarter of that town of 900 people. So so that's a reasonably significant number of people. So some of our, at least one of our towns has really been able to take the information that we provided and use it in a lot of different ways. And that's an ongoing process for them. So I'm actually now going to hand over to Kate, who's going to talk a little bit more about, because we've been part of this project with the Prevention Centre, we've been able to have that addition of some input from them and involvement in some reflection sessions. And Kate's going to speak a little bit more about that now.
Thanks, Kim. So I guess having this opportunity to really take the time to reflect on citizen science as an approach, and here's a lovely illustration from Kylie, so you can see some work she's done earlier. So I think having that opportunity to think about how citizen science assisted with the walkability assessment of rural towns, we looked at the approach and what aspects of it supported the project. we looked at the feasibility of that tool, I guess from a policymaker's perspective. How would this tool operate outside of a research environment? Could a range of towns access this, and could they generate the approach themselves and then generate a report of equal quality, or what kind of support might government need to provide them? We looked at some of the aspects of what it's like to work with citizen sciences and some of the strengths and some of the potential challenges of that approach. We also explored some of the best approaches to communicating the findings to maximise the usefulness of the project at a local level. And I think all of us online would know that often there are great research findings that never really realise their full potential because of our ability to communicate them in the right way. So we also reflected on ways to capture the impact of the work, and you can see there that Kim has, following that reflection, we did start to really think, where will we look for ideas that this has been a really useful process. So I might just talk about some of so I guess here are some of the reflections from participants. I might have to move the picture of you all to read them. I might read them out because it gives quite a lot of detail here. So one of the participants in the reflective session said, the whole point about this citizen science type approach is that it normalises the reality of local people generating their own local knowledge in skilled and informed ways. And that shifts the potential power from experts as people who come in and do things to experts as resources to support communities, to value shared knowledge creation. And I think we've really seen that. Another participant said, I think that generating local knowledge in the context of action for action is very powerful. So the idea that the community themselves generated the knowledge and can use it for advocacy is part of what drove this project. I guess too that we're hoping to generate a methodology that's applicable to other contexts so that communities themselves can pick up something like this. And then also for government to be more responsive to community identified needs. Because I guess when we're thinking about that at a practical level, and as part of that workshop, we really identified there's a lot in the research process, and particularly in support for local champions, whatever support they need, and in facilitating that local discussion to add that extra layer of sense making that takes a lot of skill and time. I think we wouldn't want to underestimate that. So some of these issues related to feasibility and sustainability is some insights. It depends a lot on the person that we come to as our leader. Yeah, it does require a lot of support for them, from just contact between me and them in guiding them. What's the next step through each step of the process? But when we found someone who was really interested, was super invested and motivated. So I guess that's the benefit of having people in the context of where they can act. They're very motivated to find out the best approaches and priorities for their town. Another participant said, we wanted to create a tool that communities can use. That's what I would like to see at the end, that there is a tool. There's some resources that can support that, and someone who's already in a community says, I want to do some walkability stuff, and I go, oh, here we are. Here's this nice stuff that's been developed that I can use. And I'll say, go, and they can run with it themselves. So I guess another part of this project has been really to think about a wider application of citizen science, and some of the reflections after that session were really, what are the benefits from a policymaker's perspective? So again, just reinforcing that idea that local data collection to support local action. You know, when I have a statewide approach and I'm thinking about how do we genuinely engage with local level need, I think it's really helpful to have a source of potentially benchmarked data as well. It's always one of our principles when we're working on health and wellbeing to empower communities to come together to set priorities. And I think this provides a very useful method for doing that. it's also a good way to share knowledge. And I mean, even those workshops in themselves and the way that communities came together and discovered new things about their town, I think action can happen immediately after that. It doesn't even need to wait for the report, but just having that knowledge generated within that space by the people that live there. But it's also that idea that citizen science gives people access to new insights, and it also stimulates innovation. I mean, some of what we've seen is that people realise that they're actually in a good place to take action, or they see a grant that comes up that relates to, you know, their priority, and they've got a report that they can use as evidence for why, you know, they should be successful in the grant process. But also for communities to engage in discussion around policy and to have influence over policy. I think that's a really effective method as well for us to talk about what we're trying to do at a policy level, but also to get feedback from community. Citizen science is a very useful approach too for supporting action learning research, and that's a methodology where we try to allow people in the context of action to learn new things about what they're doing, to have insights for future.
Thanks, Kate. It's hard operating slides for someone else at a distance. I'm not sure whether you wanted to do more on the reflection session. I'm sorry if I cut that slide short.
You did a good job.
So then we also, as a sort of researchers, have thought about the value of citizen science for research. Often it can be seen as sort of a mechanism perhaps of getting the community to sort of take on board some of that data collection for you, and obviously that's part of it. But we certainly found that our citizen scientists still needed the support of someone from the research team around that process. We did find that our community members were really great at collecting their local data, and as I said, really it was really important and so critical to have their additional sense making and to help really that they were able to identify their own priorities rather than it being the researchers or the policymakers' priorities. And as we've sort of demonstrated that by providing that data back to the community in a way that they asked for and have found useful, they have been able to use it for advocacy at a local level. So that's great. Just also, I guess, a follow-up from that is that building off that pilot work, we were successful in getting a Medical Research Future Fund grant in 2020 to progress this work. To extend it, I guess, a bit more around developing benchmarks around walkability in rural and regional towns and using the more sort of traditional spatial walkability assessment processes. And we specifically focused on 92 small towns here in Tasmania, which are towns with populations of 6,000 or less. And about a quarter of Tasmania lives in these small towns. So it's a reasonable percentage of our population. And we were also wanting to develop a tool that, the auditing process had been a pen and paper approach, and we'd asked people to fill that in, or our project officer had sort of had to put it into the electronic sort of survey format for them. So we have been developing an online tool, and we're extending it to 10 towns, of which we've sort of ranked those 92 small towns against each other and divided those into deciles, and have chosen a town from each of those deciles. And we're in the process. We've got 3 towns currently collecting data, got another 3 identified, and then at the end of the year, we'll do the final 4 of those 10 towns. This just gives you a little bit of a snapshot of what those maps and things looked like that we developed using those spatial assessment processes and the development of our tool. And this project's called Communities for Walkability, and it does have a website, walkrural.com.au, and all our reports are on there, and the towns that are currently collecting data are on there, and some information about citizen science as well we've linked to. Obviously, we've been funded. The initial pilot was funded through NH and MRC, and then the second one through MRFF. A whole huge team of investigators, including our partners from the Department of Health and the Local Government Association of Tasmania, and of course our citizen scientists. So that's it from us. I can stop sharing. Perhaps.
Fantastic. Thank you very much, Kim and Kate. That was fantastic to hear it all presented together and to get some of your reflections on using the citizen science approach and its potential benefits for policy processes as well. Does anyone have any questions for Kim or Kate? I've just noticed that there's one in the chat from Michelle saying that she'd love to know where your focus in the Northwest is and how she can get involved.
That's great, Michelle. Well, the town was Smithton, obviously was in our pilot town, but we are going back to the Northwest. We still have to finalise. One of our current towns is Zeehan, and we will be sort of, I think Railton is also sort of up in that sort of northwest area as well. So very happy for you to actually get in touch with me if you'd like, or Kate through the department. I'm sure would be very happy to connect you through that. So yeah, very happy to do that, share email address or contact details with you.
Oh, thank you. And I think Yvette, did you have your hand up? Did you have a question?
No, that was just a clap emoji. It looked a bit like a hand, but yeah, well done. Thanks.
Thank you. And it looks like there is a question from Alison in the chat as well. How have you engaged with state government, if at all, with the project, and how do you see state government working with local councils to engage in a similar citizen science process?
So I guess I can probably respond to this because I am from state government, so within the Department of Health. So I think really this initial idea came from the Department of Health. We were testing out a different methodology with local government because we were thinking, wouldn't it be great if there was a tool to kind of benchmark all the regions so we could consider how to invest? And so we worked with RMIT to look at one of their livability indicator tools, but we found that it didn't apply well to regional or rural contexts. And we found that the topography also meant that it wasn't necessarily a useful tool. But we have subsequently worked with RMIT as part of this project to look at having a more regional, rural type of tool. So the idea is we're trying to test the methodology so that state and local government can work together to use a methodology like this. But I think as we've been reflecting, it also takes a bit of an investment. So what would that look like? And some of my team are online today, and we've been talking about, whenever we're doing any of these initiatives, what's our capacity to support towns differently based on what local resources they have. So that's definitely part of our consideration as part of, we've just released the Healthy Tasmania strategic plan, and it has definitely links with this work as well.
Thanks, Kate. There's another question asking when the tool will be available.
Yeah, good question. No, well, we are currently using it in the field, so with our next 3 towns. So I guess at the moment it is, linked to our research project and doing the sort of work with our 10 towns. But the idea really would be that that it is something that others could use. It's taken, like a lot of these things, longer than you anticipate to sort of fine-tune the technical bits. So even though we're out in the field, we're obviously still picking up some of those technical challenges. But by the end of the project, the plan would be that that should be available. It's not actually an app, it's a sort of website link. I think the decision was that actually would be easier. It looks like an app, but so you can do it on your phone, you can collect the data and upload later. But but it's not it's not actually an app. But yeah, so probably I'd like to think sometime next year it might be more available, or at least we'll have a better idea of whether it's working well enough to make it more broadly available, I guess, for use, or whether it needs some further fine tuning.
Fantastic. I had a question about like how walkability data was collected in Tasmania before this tool, or if it was collected, or how would you have previously made decisions around if changes were kind of required?
I think I'm not sure if we have anyone from local government here online, but I think some of that happened at a very local level, and I'm sure they have a range of tools that they use, but I think there's a lot of variability across local government depending on their size as well and what resources they have available. They definitely have a program of improvement of the surrounding areas, but some of this was also about highlighting some of the priorities that you may not see if you just looked at the condition of infrastructure, because I think highlighting those issues for towns around connectivity and the joining up. I know that there are a range of walkability tools that come from a built environment perspective as well.
Yeah, okay. I was just interested to know if other tools as well had sort of incorporated members of the public as well and in collecting the kind of data that you have, or if they've used different approaches.
I know that Clarence City Council, as part of, they got a Healthy Tasmania Fund grant and did a piece of work that engaged with citizens there as well. And I think their report is on their website.
Yeah, okay. Yeah, because presumably it would be really hard to collect information from across Tasmania without having members of the public involved in that process, because then it would sort of rely on people like manually collecting that. Or I'm not sure. I'm not an expert. I'm just guessing, but.
That's okay. It might be useful to reflect on, so the way the spatial sort of assessment of walkability has been conducted as part of the MRFF grant. So that has basically 3 key elements, which I hope I'll remember. It's about density of sort of the actual sort of living density. It's about connectivity, and it's about destinations. And so essentially, the work that was done, the people who did that was Melanie Davenant, based at RMIT, and she wrote to councils to see if they could provide information about destinations and things like that. So that's the way walkability is often assessed. But we've certainly been having discussions about some of the limitations of that in rural towns and things like that, because particularly small towns, you might not have a school or a shop, and you might not necessarily expect to have those things, but you might have great access to a beach, or you might have access to a river, or you might have access to sort of natural features of your environment that might support active living in a different type of way. And that might be the reason why people would choose. And, in small towns of 300, you're not going to advocate to build a school just to improve your walkability. So we have had some discussions about that, and I know Melanie's quite open to sort of looking at that and thinking about that in that rural context, that there are different things. And our smallest town, it was apparent that there were other small towns in their area, and they sort of shared the facilities between those small towns, but they still all required you to be able to probably drive 10 or 15 minutes. But one town had the tennis courts, and the other town had the primary school, and another town had something else. So again, you wouldn't sort of advocate that all those towns in those areas with small populations should have all of those facilities. So again, it's just being really, I think, aware and mindful of those factors in rural settings.
Right, thank you both. There's a question from Claire in the chat as well, saying she loves the project. Are you monitoring any measures of social capital? And she says, I imagine that the benefits may extend beyond this project.
I don't know, Kate could speak to this, but certainly the town where they've had the most advocacy around this that it was the social disconnection that I think they realised during our workshop, that the physical disconnection was actually having a real impact on the social sort of connection in that town. So while our measure, like the audit process, doesn't capture that as such, the discussion really revealed that that was a real issue. And one of the people from those towns is on our community reference group, and she keeps going, you know, she has said, as following the project, the more she's thought about it and others have discussed it, they're really aware of that impact on the sort of social connection, so social capital. So yeah, you're quite right about that.
Mm.
And if it's clear here, if I could just add to that, the reason I'm so interested is that I think it would be great to be able to also, it might make a stronger case for more citizen science projects in future if they're able to understand that the benefits go beyond that particular project, because the ROI then becomes much more, sorry, the return on investment becomes much more. But I know that social capital is quite difficult to measure in a way that is, you know, quantitative enough for perhaps some of those measures, but that's great to hear. I'm just so inspired by this project. It's really great to hear. So thanks for sharing.
It's great.
That's great. Thanks, Claire. On that question, I wondered if either of you have any reflections, because it's great to hear about the advocacy that's been happening in some of the towns, and I wondered if you had any reflections on how to kind of support that process, you know, maybe in other areas or across other projects.
I think, you know, before we put the reports together too, we did have conversations with local government, who are often the target of advocacy, to get an understanding of also what format would it be best for them to receive the information in, because also we know that local council, certain sections are real advocates of this kind of work. So that if we can make a powerful case and present it in a way that, you know, it allows them to set it as a priority, that's helpful as well. Does that address your question? I felt like there was something else there that I'd forgotten.
Yeah, that's great, thanks.
I mean, I can just add, Yvonne, that in the MRFF grant, we've tried to build in, I mean, with our pilot work, we didn't, you know, have the additional resources to do some of that, but we have written in to try and develop some advocacy, and that's certainly coming up, and we're going to work on that in the sort of next year. Our community reference group will have some good input, and our sort of process evaluation, we'll be asking them a bit more about some of that.
Fantastic, thanks, Kim.
I had a question. I just wanted to jump in. Kate, you started to talk there about, you know, formulating the results in a way that was appealing to local government as well and was usable for the local government. And I just wondered, when Kim, you spoke previously about how citizen scientists, as part of the audit, sort of collected information that went into program and policy scores. And I wonder if you could expand a bit on that and how that information sort of was used in the report, or was framed in the report for local government.
So what, obviously in the audit process, when we were asking our citizen scientists to collect that information, they weren't necessarily aware, but when we went back and did the workshops, so the easiest one was probably we went up to Smithton and had a discussion, and there was a council member, you know, they were part of that discussion process, and they said, oh, we've got a trail walking plan from, you know, 15 years ago or 12 years ago or something, you know, and basically produced that, and were able to share that with us. So we did try and collect a little bit of that additional information and could then refer to that. So that was the report where we referred to that existing sort of trail plan quite a bit, because many of the priorities were still sort of relevant and similar to that. So I guess that's where having that additional layer of sort of pulling things together and coming together. And going forward in our new version of the project, we've cut back a lot on the questions around policies and programs, in recognition that our citizen scientists may not be as aware of those. I don't know if you want to add anything, Kate.
I guess just when I was trying to reflect about some of the aspects of citizen science, I think that community policy dialogue is really important. That, you know, because often local government consults with communities in different ways depending on their capacity, but different members of the community will never engage in that. They're not aware of it, the language of it, the timing of it, etc. So I think even as part of this, that communities develop greater understanding of how they can have an impact, how they can engage with both state and local government. And at a state government level, we're trying to think how we can be more accessible, how we can facilitate the kind of community-driven priority setting, as well as the meeting in the middle with, you know, our responsiveness. But I think for them to understand they can have a say, and that, you know, there's ways to use local data to help decision makers make fair, reasonable decisions.
Fantastic, thanks, Kate. Well, building on that point, I had one other question, and this one's for you, Kate. I wondered if you have a sense of whether there's any interest or plans to use a citizen science approach in other areas of government in Tasmania.
I know that as part of the planning for the Healthy Tasmania strategic plan, we've kind of been thinking about how do we embed it. And it's almost at different points, it's, you know, our newness to this, and it's how do you use this tool in a way that creates real-time feedback. And we were thinking at different points, is it to even get a sense of who knows, for example, about our strategic preventive health strategy, and does it make sense to them? Do they support the actions? You know, even that level of feedback we think would be useful. So we have considered it. We probably are progressing our literacy in terms of what citizen science is and some of the approaches, and we'll probably need to do a bit of a feasibility assessment as well, because we've got a lot of things, and it's like we need to think about the right engagement tool, I think.
Yeah, it's exciting though. Did anyone else have any other questions that they wanted to ask Kim or Kate, or any kind of reflections they wanted to add? Claire, go ahead.
Thank you. Kate, what you just said there sparked a question. Is are you involved at all or connected at all to the health consumer body that is in Tasmania? I think it's Health Consumers Tasmania, I think.
Yes, we do work closely with them, and they've been recently funded to support some health and wellbeing networks.
I've heard about that.
Yeah, so
I'm so excited. I hope it comes everywhere.
Yeah, so we're working with them around that, but yes, across. I mean, we've engaged them as part of the development of our strategy, and also guiding the implementation of it as well.
Thanks. And so in relation to the citizen science, they've been involved in that part?
I don't think we have involved them in this particular project, but we have talked with them about citizen science methodology. Yeah.
Because I'm from the state consumer group in Perth, in Western Australia, and I guess one of the things I'm curious about is that I think the cohort of people who are involved in health consumer organisations, and there's one in each state, except at the moment South Australia, which I know is looking again, but often you get people who have become interested in the health system because they've had some experience with the health system, but they're actually almost kind of quite predisposed to be interested in that primary prevention and community health too. So that's certainly something I'm interested in exploring in our kind of patch here. So that's great to hear. Thank you.
Great, thanks, Claire. And did anyone else have any other questions or comments?
I had a quick one, sorry. Yeah, journalist for Dryden Transport for New South Wales. Really amazing approach, and well done on getting such great tools and data together. I'm interested to understand if you've had any involvement with, given your engagement with RMIT, any involvement with the Victorian planning, state planning bodies in relation to their 20-minute neighbourhood approach. I think it sounds like the cornerstone of that approach is direct citizen engagement in early stages of planning processes. Yeah, I guess just curious to see if there's been any kind of cross-pollination.
Not that it's a good question, and I know that there is a lot of work, and obviously the urban planning space, you know, this certainly fits with that. I know the Hobart City Council were really interested in sort of our approach, and they were trying to do a bit of revitalising in some parts of the city, and did approach, I think, one of the other investigators, Verity Cleland, around that. But no, we haven't had any direct connection to that particular project in Victoria.
I guess we've definitely considered some of that literature as part of our actions around the built environment. Some of that lends itself more to larger, more dense populations.
I just wanted to, I've realised that our project officer for this work, Ollie Stainsby, is on the line. So I will acknowledge the work that Ollie did in supporting our citizen scientists and data collection as part of the project. As I said, while it was a different approach, our citizen scientists and community members did require a fair bit of support, and Ollie did a great job with that. So, well, thanks, Ollie.
Brilliant. Well, unless there's any other questions, we have a couple of minutes if anyone else has any other questions they'd like to ask or anything else they'd like to say. Otherwise, we have a quick feedback survey that we'd like to share with you before you go. It should only take a couple of minutes, and it's just really helpful for us to help with our planning processes for future sessions. So I'll just share that with you now, and we'll put the link as well in the chat. Just bear with me. Sorry. There we go. So yeah, so I just wanted to say as well, a huge thank you to Kim and Kate for the fantastic presentation, and thanks everyone for coming along and asking questions and contributing to the discussion. I've really enjoyed listening to your questions and everything that you've had to say. So thanks very much again for coming along. If you can share a couple of minutes before you head off, then we'll pop the link to that feedback survey in the chat, or you can use the QR code on the screen. And when you complete the survey, it'll, I think, Leah, is that right? It takes you to a link to how you can sign up to the community of practice as well, so that you can get some details on that.
Yeah, absolutely. And I'll pop a link in the chat as well. If you want to hear about upcoming sessions, sign up to the community of practice and you'll get that information.
Fantastic. Thank you. And maybe we could pin, if I stop sharing, maybe we could pin Kylie's fantastic illustration as people are heading off as well, so that you can see. Let me just, fantastic. It always amazes me how this comes together in such a short space of time. Thanks again, everyone, and hopefully we'll see you at future community of practice sessions.